The mahogany boardroom of Peterson Associates Law Firm gleamed under crystal chandeliers as the quarterly Peterson family business meeting reached its crescendo of professional one-upmanship. My brother Marcus commanded the head of the conference table, his tailored Armani suit and platinum Rolex catching the afternoon light as he gestured toward the quarterly revenue charts displaying his legal empire's latest triumphs. The pharmaceutical liability settlement alone brought in $12.7 million this quarter, Marcus announced with the confidence of someone who had never doubted his own success. When you combine strategic litigation with corporate mergers and acquisitions, you create multiple revenue streams that ensure long-term financial stability. Our father, retired federal judge William Peterson, nodded approvingly from his traditional seat at Marcus's right hand. That's exactly the kind of strategic thinking that builds lasting wealth. Marcus understood early that law isn't just about justice. It's about creating sustainable business models and diversified income sources. The observation was pointed, designed to highlight the contrast with my own career path, which they viewed as a series of missed opportunities and poor strategic decisions. Dr. Emily Peterson, the family disappointment who had somehow managed to waste her medical degree on what Marcus consistently characterized as entry-level healthcare employment. My sister-in-law Catherine, a successful pharmaceutical executive, joined the conversation with her own analysis of professional achievement versus personal satisfaction. The healthcare industry rewards strategic thinking and business development, not just clinical knowledge. Emily could have leveraged her medical background into consulting, device sales, or regulatory affairs, careers with real growth potential. I sat quietly in my modest navy dress, observing the familiar dynamics that had defined these family gatherings for the past 8 years. Since completing my residency, I had endured countless variations of this conversation, each family member contributing their perspective on how I could better monetize my medical education. My uncle Richard, who had built a successful chain of outpatient surgical centers before selling to a national healthcare corporation, offered his standard career counseling. Emily, the independent practice model is dead. Solo physicians are being absorbed by hospital systems, which are then acquired by private equity firms. You need to transition to the business side before you get left behind. Richard's absolutely right, my Aunt Patricia chimed in, her background as a healthcare system CFO lending authority to her observations. Clinical medicine is becoming increasingly commoditized. Real value creation happens at the administrative and financial levels: population health management, risk-based contracts, value-based care initiatives. Marcus leaned back in his executive chair, clearly enjoying his role as the family's business mentor. The problem with Emily is that she lacks vision. She chose medicine to help people, which is admirable but financially naive. She could have been a healthcare attorney, making partner-level income while still contributing to medical advancement. The criticism stung with its casual dismissal of both my motivations and my intelligence. In Marcus's worldview, anyone who chose direct patient care over healthcare business development had fundamentally misunderstood how to maximize their professional potential. My cousin David, fresh from completing his MBA at Stanford, contributed his theoretical expertise about healthcare industry consolidation. The sector is experiencing unprecedented consolidation. Independent practitioners are being replaced by employed physicians, hospital systems are merging with insurance companies, and private equity is buying everything. Emily needs to position herself strategically in this new landscape. David makes an excellent point, our father added, his judicial background evident in his systematic analysis of market trends. Healthcare is becoming increasingly corporate and financially driven. Success requires understanding both clinical operations and business strategy, not just following medical protocols. Through this extended critique of my career choices, I maintained my composure, occasionally nodding or asking clarifying questions about their observations. They had no idea that my position at Community Health Partners was strategic, carefully chosen to maintain direct patient contact while managing significantly larger responsibilities. My phone buzzed with a text from my chief financial officer. Q3 insurance network revenues exceed $2.8 billion. Premium increases approved for January. Board meeting Thursday to discuss acquisition targets. I glanced at it briefly before returning my attention to the ongoing analysis of my professional shortcomings. Catherine, emboldened by the supportive audience, decided to escalate her assessment of my career limitations. The pharmaceutical industry has taught me that healthcare success requires thinking systemically about market opportunities. Emily works at the clinical level, but real influence happens at the policy and financial levels. FDA approvals, insurance coverage decisions, population health outcomes. Marcus nodded emphatically, his legal training evident in how he constructed his argument. You wasted medical school on grunt work, Emily. While we built businesses that create jobs and generate wealth, you chose the path of individual patient care. It's noble but ultimately insignificant in terms of broader impact. The conversation continued in this familiar pattern for another hour, with various family members reinforcing the theme that my medical career represented a failure to think strategically about professional opportunity and wealth creation. My brother suggested I consider medical malpractice law, leveraging my clinical knowledge to build a litigation practice. My uncle recommended healthcare consulting, using my operational experience to advise hospital systems on efficiency improvements. The mood shifted dramatically when the law firm's receptionist knocked on the conference room door, her expression mixing professional courtesy with barely contained excitement. "Excuse me, Mr. Peterson, but there's someone here requesting to speak with Dr. Emily Peterson urgently. He says it's regarding insurance claims that require immediate attention." Before Marcus could object to the interruption of his business meeting, a distinguished gentleman in an expensive suit entered, briefcase in hand and expression serious. I recognized him immediately as Thomas Mitchell, Executive Vice President of Peterson Healthcare Insurance Network, though my family had no reason to know who he was or what organization he represented. "Dr. Peterson," Mitchell said formally, his voice carrying the controlled urgency of someone managing a multi-billion-dollar enterprise, "we have several high-value claims requiring your personal review and approval. The pharmaceutical costs alone exceed $800,000, and there are questions about covered versus experimental treatments." The silence that followed was profound. My family stared at Mitchell, then at me, their expressions cycling through confusion, disbelief, and dawning comprehension as the implications of his words registered. Marcus was the first to find his voice, though it emerged with uncharacteristic uncertainty. "Insurance claims? Emily, what is he talking about? You're a staff physician at a community health center." Mitchell looked genuinely puzzled by the question. "Sir, Dr. Peterson is the founder and CEO of Peterson Healthcare Insurance Network. We provide coverage for over 1.2 million members across 6 states, employ 43,000 people, and generate annual revenues exceeding $8.7 billion. I accepted the claims review tablet from Mitchell, quickly scanning the high-cost cases requiring executive approval. Several names caught my attention immediately. Family members whose expensive medical treatments and specialist consultations were all processed through the insurance network I had built. "The experimental cancer treatment for Marcus Peterson looks appropriate given his oncologist's recommendations," I said, reviewing my brother's recent claims history. "Approve the $47,000 monthly immunotherapy protocol. The fertility treatments for Catherine Peterson are covered under our expanded reproductive health benefits. Approve continuation." As Mitchell departed with my approved authorizations, my family remained frozen in stunned silence. The afternoon that had begun with criticism of my wasted medical education had suddenly transformed into something none of them could have anticipated. My father was the first to recover, his judicial instincts automatically processing the legal and financial implications of what he'd just witnessed. "Emily, did he just say you own an insurance company worth $8 billion? I founded Peterson Healthcare Insurance Network 6 years ago, combining my clinical knowledge with actuarial science and population health management," I explained calmly. "We've grown through strategic acquisitions of smaller insurance companies and innovative coverage models that reduce costs while improving outcomes." Marcus, whose legal practice suddenly seemed modest by comparison, stared at me with complete bewilderment. "But Emily, you work at a community clinic. You drive a basic car. You live in a modest apartment. How can you own billions of dollars worth of insurance infrastructure?" "I work 2 days per week at Community Health Partners because I founded it 8 years ago to understand healthcare delivery from the provider perspective. The car is reliable transportation, and the apartment is actually a penthouse with offices for managing the insurance network." The truth continued to unfold as my relatives processed this complete reversal of everything they thought they knew about my professional life. The grunt work they'd been encouraging me to abandon was actually the management of one of the largest healthcare insurance networks in the region. The entry-level healthcare employment they dismissed was actually entrepreneurial leadership that had revolutionized how insurance companies evaluate and cover medical treatments. Catherine, struggling to reconcile her new understanding with years of condescending career advice, found her voice first. Emily, if you own an insurance network worth billions, why didn't you tell us? Why let us think you were underemploying yourself? Catherine, every time I tried to explain my work in population health management or actuarial medicine, you redirected the conversation toward pharmaceutical sales opportunities. You'd already decided what my career looked like before you bothered to learn what it actually involved. The evening that followed was surreal, as family members who had spent years critiquing my career choices suddenly realized that their own medical care, insurance coverage, and healthcare expenses were all managed by the company I had built. Marcus's cancer treatments, Catherine's fertility procedures, my father's cardiac medications, all covered by policies and networks I had designed and implemented. Richard, whose surgical center chain suddenly seemed insignificant, shook his head in amazement. Emily, we've been giving you business advice while you built a healthcare insurance empire worth nearly $9 billion? That's about the size of it, Uncle Richard. But what affected them most was learning that my wasted medical education had actually enabled me to build an insurance network that delivered better health outcomes at lower costs than traditional insurers. My clinical knowledge informed coverage decisions that reduced unnecessary procedures while ensuring access to truly beneficial treatments. Marcus, reviewing the insurance claims I had just approved for his family, approached me with newfound respect and more than a little embarrassment. Emily, I owe you an enormous apology. We all do. I've been completely wrong about the value of your medical background. Marcus, you weren't wrong about healthcare requiring business thinking. You were wrong about assuming that clinical medicine and business strategy were mutually exclusive rather than complementary. Over the following weeks, the family dynamic shifted dramatically. The quarterly business meetings that had excluded me suddenly seemed incomplete without insights from the healthcare insurance sector. The career advice sessions stopped entirely when they learned that my personal net worth exceeded the combined wealth of our entire extended family. Some family relationships are built on assumptions about success and achievement that persist until dramatic events force complete reassessment. Ours was transformed by the realization that the relative they dismissed as lacking business acumen had actually built something extraordinary while they were focused on their own narrower definitions of professional accomplishment. As I left the law firm that evening, walking past the parking garage toward my basic car, actually a hybrid chosen for environmental efficiency and operational reliability, I reflected on the strange irony of the situation. My family had spent years encouraging me to abandon clinical medicine for more lucrative business opportunities, never realizing that I'd found a way to combine medical knowledge with business success on a scale they'd never imagined. The grunt work they'd mocked was real. I still saw patients during my clinical days at Community Health Partners. But it was also the foundation for understanding healthcare needs from multiple perspectives: clinical, financial, actuarial, and population-based. That comprehensive understanding had enabled me to build an insurance network that actually improved healthcare access while generating billions in revenue. Some people abandon their clinical training to achieve business success. Others use their medical knowledge to transform entire industries. The difference isn't always visible from the outside, especially when family members are too busy offering advice to recognize that the person they're counseling has already achieved everything they're suggesting she should aspire to.